So this is going to be the manual muscle test for hip abduction, which is primarily testing the glute min and med. The test position for this is going to be inside lying, which my patient is already in. What I'm going to have you do, Maddie, is the bottom leg, I'm going to have you bend wherever's comfortable. And then the top leg, we're going to try to keep in line with your body. And what I'm going to have you do is first just lift that leg up as high as you can. Perfect. Come back down. Awesome. Then I'm going to take you through that motion. Relax the leg. Perfect. So active and passive are the same. So now what we're going to do is we're going to test the strength of some of these muscles. So I'm going to have you put your leg in that position, hold it. I'm going to try to push you down. So come down a little bit. Right there is perfect. I'm going to apply pressure at the ankle. If she couldn't handle the ankle, you can switch to the knee. 5, 4, 3, 2, and 1. You can relax. So her manual muscle test there would be 5 out of 5. If she couldn't handle that or it was 3 or less, you can put her in supine and go through a range of motion that way. So this is going to be the manual muscle test for the hamstrings, and specific the lateral hamstrings or the biceps femoris. The test position we're going to have our patient in for this is going to be in prone, which my patient's already in. So what we're going to do, excuse me, Maddie, is we're going to go ahead and curl this leg up towards your butt. Awesome. Come back down. And then I'm going to go ahead and do that for you. So you relax. Active and passive would be the same. So the test position for this is going to be knee flexed to about 45 degrees. And then again, to address the lateral aspect, we're going to have the foot pointing laterally. So now what I'm going to do is hold this position right here. I'm going to try to push your foot down and in. Don't let me, okay? So hold it there. 5, 4, 3, 2, and 1. You can go ahead and relax. Her manual muscle test would be 5 out of 5 on that. If she could not tolerate that, or you had a grade of 3 or less, you can put them in side lying as the therapist supports the leg and go through the motion that way. This is going to be the manual muscle test for the big toe and toe pip and dip flexion strength. The test position for this is going to be either supine or long sitting. My patient is in long sitting. And what I'm going to have you do, Maddie, if you don't mind, is I'm going to have you curl your toes as much as you can. Perfect. Relax. And then I'm going to run through that same motion. So active and passive are the same. So now we're going to test the strength of these muscles down here, Maddie. So what I'm going to have you do is I'm going to have you curl your toes, hold that position. My hands are supporting on the back. My thumbs are kind of applying the pressure, and I'm going to try to open up your toes. Hold it for 5 seconds. 5, 4, 3, 2, and 1. Awesome. So her manual muscle test would be 5 out of 5 on that. If she were to get less, the test position would stay the same. And you can just see if she can hold the position of her toes without any force, and or you can palpate for some trace muscle activation on the bottom of the foot. So this is going to be the range of motion test for knee extension. This test is best done in supine. And then what you're going to want to do is prop your patient's ankle up. I'd have a bolster here, but you can use a towel roll if that's all you have access to. So Maddie, if you don't mind, can you lift both your legs? Awesome. What I'm going to have you do, Maddie, first is I'm going to have you just bend your knee. Perfect. And then straighten your knee out as straight as it can go. Any pain with that?
No.
Awesome. I'm going to take you through the same motion. Let it rest. Any pain? Awesome. So that'd be a firm end feel. So we're going to go ahead and take the measurement here. Our landmarks, our axis is going to be at the lateral epicondyle of the femur. Our stationary arm is going to be midline of the leg, with our endpoint being the greater trochanter, and our moving arm is going to be the lateral malleolus. So I'm going to go ahead and take her measurement here. Maddie, if you don't mind, can you try pushing your knee a little bit down towards the table? Good job. Perfect. And then any pain with that?
No.
So Maddie has a little bit of hyperextension, which is very normal, about 2 degrees. I believe you can have 2 degrees of hyperextension to 5 degrees is the anatomical norm. So this is going to be the range of motion test for the first MTP joint abduction. The test position for this is you can either be in supine or seated. Seated, I think, is easier. This motion is pretty challenging for most people, so we're going to do passive range of motion. So Maddie, I'm just going to go ahead and move your toe inward. Any pain with that? Any
No.
issues? I would say it's a firm end feel. You can try, Maddie, to bring your toe in. So there's a little movement there, but pretty challenging. So the landmarks for this is the stationary arm is going to be the dorsal midline of the first metatarsal, apologize. The axis is going to be the dorsal midline of the first MTP joint right here, and the moving arm is going to be the dorsal midline of the proximal phalanx of the great toe, so here. And again, as I mentioned, we're going to do passive range of motion with this one, so you go ahead and relax. Good job. Any issues with that?
No.
And we're getting about 6 degrees of motion. So this is going to be the muscle length test for the TFL and IT band. This is going to be a modified Oberg, not just the Oberg. So the test position for this is going to be in side lying. The leg that's closest to the table is going to be bent at about a 45-degree angle at the knee. Again, it's comfortable for the patient. Maddie, what we're going to do is we're going to lift our leg, and then we're going to come down, and we're going to let me know how that feels. So I'm going to do it for you. So you relax. We're going to come down. Any pain with that? Any issues?
No.
Awesome. I would say that would be a firm end feel. And then since there is already so much mobility, can I have you scoot a little bit closer to this edge of the table? So straight back towards me. That way the table isn't limiting the leg. So what we're going to do is avoid any kind of flexion and internal rotation of the hip. Maddie, I'm just going to have you relax the leg. Go down here. Right there, we're getting some tension. Again, no pain for you?
No.
Awesome. So not a positive test. A positive test for this would be if the patient could only would still be abducted even upon relaxing all these muscles. Neutral or anything under neutral would be a negative test, which she definitely is.